we are trying our level best. Health is not the area where we can do siasa. We can do siasa with the lives of people on daily basis.
Assuming the current
2 years ago, we are able to do all the 6 scans on our patients. Formerly, before, we used to refer our patients to Kericho, to MTIH, and of course, Kenyatta. But since the devolution, currently we are doing all the 6 scans in Nyamira. We have no reason to refer any patients. We have radiologists who reports daily on our 6 scans.
For the state, I want to thank you so much for taking time to come and fact-find on the allegations that were raised yesterday by a very senior politician on our inadequacy as a hospital to offer some very key services that our patients in Nyamira are enjoying. I want to start by saying that the allegations are baseless. The allegations are there without proper information, and our patients who've come to Nyamira receive the service. And I want to say, wherever you go, like even in your home, there are challenges which might be there. Something was not done right here and there, but the basic life care services a patient needs to receive before we refer or do anything are done. Number 2, we're also trying our level best to make sure that we reduce the number of referrals that we are doing, and that is why we are even engaging consultants of a higher level so that they can come and do the services within the county and in our county referral hospital. Number 3, there have been allegations about ambulatory system. I can confirm, like you've taken photos, you've taken the videos on the status of our ambulatory system in the county referral hospital. It's up to date. There were allegations about the CT scan. You've already confirmed whatever that I wrote yesterday in the media about the CT scan. We have got 2 CT scans, a 16 slide and a 64 slide, and both are in a working condition. Actually, we've delayed. By now we should have decommissioned one to Keroka. We're only waiting for Keroka to be completed, then we decommission one to Keroka to help our people on the other side. We've told you about our oxygen plant, and actually we have 2 oxygen plants. One that produces 540 liters per minute and another one that produces 150 liters per minute. One is the one now servicing us because we don't need 2 to run. The other one, we are also going to decommission it. Once Keroka is completed, we also decommission it the other side to help our people on the other side. And talking of emergency services, I am standing before an accident and emergency department, which we are refurbishing, and very soon we are opening it. Actually, very soon means even tomorrow or the following day. We might invite you here, only that we are having so many activities that will be happening this week, including the president coming to Nyamira. But if it were not so, we'd have called you so that we decommission, we commission this accident and emergency. Once commissioned, even the need of our ambulatory system will now be seen, because this is where the ambulances will come in, offload patients, run to the community to also pick patients that might need the call of help. Now let me speak about something very key. Ladies and gentlemen, not every patient needs referral. The healthcare workers need to sit down, analyze and know whether this patient needs referral. And once they have ascertained that the patient needs referral, then a call needs to be made to the referral facility where we are supposed to refer the patient to. That referral facility needs to tell us whether they are ready for this patient. Otherwise, we've seen cases here where we refer patients to MTRH, we refer patients to Kenyatta. They get there, stay in the ambulances for long. Sometimes they are returned back to Nyamira. That is an embarrassment, and of course we are not giving the best to our patients. So we must get the reasons why we are referring it. If a patient comes here with a head injury, for instance, the one patient that our Mheshimiwa was talking about is about head injury. And there are ways we do head injuries. You come here, assess the patient, do a CT scan. After doing that, it's reported. Then we ascertain where this patient can get the proper care that we need. We don't have to take the patient to Nairobi. We take the patient to Eldoret without the preliminary results that are needed of it. I know as a county we might have our faults. I know as a county Department of Health we might have our weaknesses here and there. But remember, we are talking about the healthcare of the people of Nyamira. And the healthcare of the people of Nyamira must be guarded with a lot of jealous, so that they are taken good care of, they are taken well care of. We recently passed an FIF bill, and that FIF bill has enabled even this hospital to even start procuring medicines for themselves. Sometimes when we get delays of disbursement, you are all aware, we are all living in Kenya, that counties have not received monies for the last 4 months. So when such delays are there, the hospital can be able to procure their own drugs to buffer up their other consignment which we receive whenever we have received monies from the monies from the national government. So I want to call upon you, the Fourth Estate and the rest of the people of Nyamira. You're free. Walk into Nyamira, get to know what is happening, and our numbers are open. You can call whenever you need you meet a challenge. The hospital line is open. You can call whenever there is a problem. They can send an ambulance to wherever the patient is. They pick him to a hospital. It is from a hospital that we refer to another hospital. We don't refer from the community to another hospital. We must bring the patient to the hospital from where we refer that patient to the next facility. So I want to call upon partners. Partners include the politicians. Partners include the people who are supporting us in giving services. Partners include you, the Fourth Estate, to come and support us in the care that we are giving to our patients. I don't know whether there's any question.